We know Germany has one of the best mental health care systems in the world. So nevertheless, 57 of those with a mental health disorder never in their life seek treatment. So when we look at the last 12 months, then it's 81%. That's in all of the studies I've seen worldwide. The primary reason is people want to solve their problems alone.
In the mental health context, right? There's so many patients who are just undiagnosed. And so that's also a critical issue. And I think the role that digital can really play is in really helping, these patients before they kind of go and see their clinician. So I think that you and I probably both believe that the future of healthcare is patient-centered. And so I'm very curious about how you keep the patient in mind within the design process and within the clinical process, and how you truly are serving the patient.
So I think when thinking about patient-centered, I think it's not about only doing user research like I do focus groups. So it's also really understanding the whole target group. For example, what are the reasons why people are not seeking mental health treatments? So we know, you said like many are they're undiagnosed. Actually, most are undiagnosed. We know Germany has one of the best mental health care systems in the world. So nevertheless, 57 of those with a mental health disorder never in their life seek treatment. So when we look at the last 12 months, then it's 81%. So, and when we look at then epidemiological studies, I'm part of the WHO World Mental Health Group, where we conduct worldwide epidemiological studies, then looked at those who did not seek treatment and reasons for why didn't they not seek treatment. Usually in the media, it's always about the shortage of clinicians. Or it's too costly. And sometimes it's stigma. So these are all very important reasons. But when we actually look in the data, then we see that, and that's in all of the studies I've seen worldwide, the primary reason is people want to solve their problems alone. So, and if you do not know that, then you like different way of product you build. So, and the way how you approach actually the patient.
Well, I'm still kind of hung up on what you said about how patients want to deal with their problems on their own. And you wouldn't have understood that or learned about that if you didn't go out and really understand patients. So, once you understand that, then you can now design products that are really trying to connect with the patient from that place. It seems like from a mental health perspective, digital can really make a big difference globally. What are your thoughts on other chronic conditions?
Like mental health is often a risk factor for a later onset of a chronic medical condition, but also the other way around. For example, having a diabetes increases the risk for depression a lot. But having a depression, again, is a risk factor for worse diabetes management. So because people are not really then able to manage their diabetes correctly, then the diabetes gets worse, the depression again. Therefore, and this is usually not being addressed in the healthcare system, because we have single treatment here for diabetes, here for mental health, and so on. So I think there's also a huge potential. So we developed, for example, one program for depression and diabetes, which was very successful. And now we just finalized 2 randomized controlled trials on the prevention and also the treatment of depression and chronic pain to address the psychological factors, how to deal with the chronic pain, which is actually, really effective.
I'd really like to understand, how you believe physicians or clinicians are responding to digital therapeutics, and what role you've played in helping with adoption.
You bring up a very interesting point, because I think that's one important next step, actually, like to educate physicians, clinicians, and to convince them. So far, It's now digital therapeutics like are out there since about 20 years. So at least in research, since 20 years we're working on that, and like I'm personally worked since over 10 years in that field, and a lot of my work was really to convince them about the potential what can be done using digital therapeutics. I think it's still the case that it only like be used so far by early adapters. But now the time has really come. I think it's now that all parts of our life are now digital. And at the same time, and that's a very important change, you have a lot of regulatory changes. In Germany, we have now the Digital Healthcare Act, which allows to enter the market, and you immediately get access to over 70 million insured patients just with one application. So it can be prescribed then by doctors. So most doctors, whether these are GPs or psychiatrists or psychotherapists, so it was not a part of their day-to-day business, and they do not know about it. And then they know these, like the free apps from the app stores, and they are all so different, and they do not know about the potential.
You mentioned, so that's wild. I didn't know that digital therapeutics had been around for 20 years. That's amazing. And you mentioned an important point around evidence-based. So, digital therapeutics are evidence-based digital experiences or apps that are offered to patients, right? And when you said, you kind of started out your journey having to convince physicians, I'm curious to just dive into that for a moment. Like, what does that look like, having to convince physicians? I think now that there's Digital Care Act and there's more education opportunities and probably more associations and credits that physicians can get to learn about the digital world. But I'm curious, what that looked like in the past. Is it, what does it entail to actually convince a physician about the power of digital therapeutics?
Yeah, actually people laughed at me when I had like talks, even like before like hundreds like of psychotherapists, physicians, and they laughed at me about said, hey, that's not going to work. So it was also, I remember this one very famous psychotherapy researcher who was very critical about it and said I said, hey, I show you how it works. So I showed him like how we treat like behavior activation, which is one important part in the treatment of depression, how we do it online. And then his reply was, yeah, it might work, but not like that. That's not how it works. And people like laughed and did not believe in it. And that changed. That changed a lot. I think it's very important to differentiate, because also what you said, like digital therapeutics are evidence-based. So it is the same as if I would say like a pill is evidence-based. I think it's really dangerous if you start to implement something which is not evidence-based, because first of all, in the field of mental health disorders, this is dangerous. So people who very often for many years do not use anything. And after 6 to 8 years, this often takes until somebody chooses to seek treatment. Then they go to this startup saying, this is great. So it's going to work. And then, the person tries it out, and the result of somebody with a depression where the core symptom is being hopeless, then is, I knew it. This might work, but not for me. I'm a hopeless case. So it's really, really dangerous, and on the individual level, but also like for the whole field. So we need to gain trust and show that this is a reliable, valid treatment option, and therefore it's really important that the stuff which is like being put out there is actually good and has value.
What a pleasure to connect with e-mental health pioneer David Ebert, who is clearly paving the way for digital therapeutics in Europe and beyond. The rise of digital therapeutics is intended to help us all envision a better healthcare system for the digital age, one that encompasses mental health and prevention. If you like what you see, please follow along our journey.